mind.
Welcome back. So right now I'd like us to talk about plastic surgery, the benefits, the challenges, why you need to do it, and why you need not to do some plastic surgery. So tonight it's all about health issues. So with me in studio, it's a young, if I may introduce you as a young surgeon, that is Thomas Amuti, an anatomist, a plastics and aesthetics doctor, a surgeon. Daktari, just as we are talking about what plastic surgery is all about, first talk to us, what is plastic surgery? So
most people will actually define plastic surgery as surgeries which involve the reconstruction of different body parts in an attempt to either achieve an aesthetic outcome or maybe be able to sort out clinical symptomatology. So, I mean, you can look at it in two ways. That those patients who present for plastic surgery predominantly because they have clinical symptomatology, in cases, for example, of enlarged breasts. And there are also those patients who come in just for reconstructive purposes. For example, if you think about a patient who has a chronic wound, maybe they would want that wound filled up. So maybe using graft or flap reconstructive procedures.
All right. So what are the types of plastic surgeries?
So you can ideally divide plastic surgery into two, or classify them into two types of procedures. So we have the cosmetic procedures and you have the reconstructive procedures. Now, among the cosmetic procedures, the major ones that we're currently doing in Kenya and at AJ Plastics include things such as breast reconstructions and breast augmentations. There's also those patients who we are able to achieve for them liposuctions, whether it be just a general liposuctions or liposuction 360s. And for those ladies who've already had their child, their children and are past the childbearing age, we also do procedures such as mummy makeovers, aka tummy tucks.
Mummy makeovers.
Mummy makeovers.
So if you have to tuck in your tummy.
Yes, kind of. Yes, and then for the reconstructive procedures, majorly in our setting, at AJ Plastics, we are majoring with chronic wounds, most of which we manage them either through debridement if needed, and then a subsequent grafting or flap reconstruction. We also have patients who are managing for keloids, which is just an abnormal growth of epithelial tissue, which tends to happen during healing. So I would say that those are the common cosmetic and reconstructive procedures we manage.
And I was about to ask you, why should one go for plastic surgery, which I think you've touched on.
Yes.
But then plastic surgery after certain areas of your body is treated, medical issues, or it actually enhances appearance. But what are the potential complications?
Okay, so when you're looking at plastic surgical procedures, the complications that occur tend to be divided based on the classification system that I've already talked about. But the three main complications that are shared regardless of any plastic surgical procedures are: one, bleeding. And the bleeding tends to happen mostly during procedure and even after procedure. But of course, several mechanisms have already been developed to prevent that, which I think is something I'll touch on later. But just to maybe illustrate a few is that, for example, when you're doing breast reconstructions or liposuctions.
But first, before you continue explaining, Daktari, is the patient, whether you're doing it for cosmetics or not, are you informed earlier before you do this process that you might get complications?
Yes. As a matter of fact, during our consultation services, one of the things that we usually labor on is usually on the possibility of complications and the manners in which you're going to avoid them, and even if they occur, the manners by which you're going to manage them.
All right.
Yeah. So, for example, when I talk about bleeding, we usually have injection of something called jungle juice. When I talk about jungle juice, I know it's a Friday, but I don't mean the cocktail. And also, I don't mean some voodoo substance that we extract from the shamba. No, it's actually a constitution of three particular liquids, which help to vasoconstrict your vessels and prevent bleeding. So that's just some of the ways in which you prevent a complication, for example, like bleeding. The second most complication in almost all plastic surgical procedures is pain, but this one usually depends on the patient. But what we come to notice is that, like in our setting in AJ Plastics, when you use the WHO guided standard for pain management, which includes a trimodal use of medication, which is paracetamol, a non-steroidal anti-inflammatory agent, and an opioid, then most patients, regardless of their pain threshold, tend to actually have no pain at all.
All right.
So just to illustrate a few, so we've been able to, so these procedures do have complications, but we prevent for them, and if they occur, then we manage them adequately at AJ
All right,
Plastics.
and someone will ask, when you talk about the cosmetics as plastic surgery, so can cosmetic procedures make significant changes, especially to the areas, a lady would want to come for just, specific areas of the body, and that are otherwise healthy. So the question is, when these complications occur for cosmetic plastic surgeries, like what happens next? Because this is, you're doing something for beauty.
Yes.
Because I know probably someone would come, okay, work on my face, or work on my hips, or work on my, sitting apparatus.
Yes.
So what happens?
So, I mean, the first thing to mention is that most of these complications don't influence post-surgical healing. Most of them are usually just complications that might influence how the patient is compliant for subsequent healings. For example, when I talk about pain, I would imagine that if a patient has their pain not adequately controlled, then even following up things, for example, antibiotic use post-surgery is going to be difficult. So just to mention that, when I've mentioned possible complications, they do not in any way affect the outcomes in terms of the appearance post-healing.
All right, but do you look at the medical history of someone who's come to do the plastic surgery?
Yes. So we do look at the medical history, especially now in relation, for example, to pain and the pain threshold. We do take very relevant past medical history and usually have a pain scale which are able to gauge the pain of the patient before we can go for the procedure. Just as an example of relevant information that we take so that we can be able to estimate or to gauge what complications a patient is going to have.
All right. So let me give you an example.
Okay.
Not that I want to come to you tomorrow. I'm satisfied the way I am.
You can actually come to us.
So what happens if I come for the plastic surgery and then I don't like the outcome?
Good.
Can it be undone?
So the first thing to appreciate is that in an attempt to prevent such a scenario from happening, during consultation services, we usually encourage the patients to come with illustrations or photos of what they would deem as what they would want as an outcome post the procedure. So most of the patients usually come, for example, if a patient wants to come for breast reconstruction, assuming they are cup G or a cup E size breast, I have had patients who come with photos showing a cup C, and then they're able to show me, doc, this is what I want at the end of my procedure. And that really helps to guide in prevention of those non-desired aesthetic outcomes. But as you've mentioned, there are those very rare cases where we have a procedure done and the outcomes are not met. We have a policy whereby the number one rule is to meet patient demands. Okay. So we do have reconstruction of the affected part where the patient may not feel like it was adequately met.
All right. So when you're doing that reconstruction and doing what the patient doesn't like after it's been done, then how do you do it? Because I mean, you've already removed what the patient didn't want, you've added something. Like how is the process going to be the same?
So
and how costly is it going to be?
Yes, so I think I'll tackle first on the aspect of is the procedure going to be the same? So the first thing to note is that most of the aesthetic desires that are not met are usually not major ones. For example, I'll give you an example of maybe a nipple reconstruction, okay? So maybe after breast reconstruction, you have a patient who says, my nipple is still, my periareolar space is still a bit huge. I mean, that's something that you can just go easily and reconstruct. So just to mention that most of the non-desired outcomes are not outcomes which significantly impact on the desired aesthetic outcome at the end of the day.
All right.
When it comes to cost, we have a policy whereby in our setting, at AJ Plastics, most of the reconstructions are actually done at the cost of the institution itself, because we do appreciate that we haven't met the demands, and the patient ideally shouldn't really meet any constraints financially. So we usually put it on the house and we're able to do the reconstruction.
But do insurance companies really, cover these plastic surgeries, be it medical plastic surgery or just for cosmetic plastic surgery?
So what you come to notice is that for patients who have actual medical concerns that overlap with plastic surgical procedures, some insurances usually have that leeway of covering. So for example, I'll give an example of maybe a patient who's come in with really enlarged breasts that are chronically, that have chronic ulcers and now they're super infected, for example. There's some insurances which consider that. However, that's one of the limitations that we have in our practice, that not all insurances usually cover for plastic surgical procedures.
All right. So, but what are the dangers of doing plastic surgeries?
Okay, so when you talk about the dangers, well, essentially there are no dangers.
The dangers in terms of scaring someone.
We can go and scare the
what are the pros and the cons of this plastic surgery as we bring this conversation to an end, Daktari?
Yes.
And what am I able to do and what am I not able to do once this plastic surgery has been done? Okay,
let me start by saying that most patients who come for plastic surgical procedures actually have both physical and psychological symptoms that are associated with them. I'll give a best example. Most patients who come in our setting with needs, for example, for breast reconstruction or liposuctions, are patients who, for example, for the breasts have neck pains, shoulder pains, back pains. Some of them can't even fit in their clothes.
Okay.
And for those who even can fit in their clothes, some of them actually have physical inability. So I have many patients who come in and say, Doc, I can't even gym anymore. You see? For the psychological impact, most of them actually come in anxiety and depression and reduced self-esteem. So post-procedure, we have this questionnaire that we have called the breast Q questionnaire that usually assesses the satisfaction of the patient. Okay. Coming to note that almost 100% of our patients who go through our procedures tend to have really high scores of the breast Q. So I would say that the pros of these plastic surgical procedures are not only physical relief of symptomatology, but also psychological relief. And most of these patients usually are very grateful. Now on the cons are really few. The cons are really few.
Okay.
But as I've mentioned, even if a con is to happen, we have management principles in which we prevent that.
Right.
The only common one that I would mention is maybe in a few patients, based on their skin healing, they might have scarifications, scar formations, which is something that's inevitable in wound healing. But we have procedures such as cavitation, which help in prevention of that.
So what am I able to do? What am I not able to do after plastic surgery?
Depends on the procedure. I can't be able to tell you that there's a there's blankets, guides of do's and don'ts do's. So for example, I'll give you a good example. So for example, when you do a breast reconstruction, the main thing that usually advise for is just not to do strenuous activity. So not to lift anything more than 1.5 kgs, usually for a period of 6 weeks, which is dictated scientifically, given that primary healing takes 6 weeks. So, I mean, the do's and don'ts will depend heavily on the procedure that's being done. Yes.
All right. And lastly, in less than a minute, a woman who's come for probably cosmetic plastic surgery for the breast and probably for the tummy tucking, what you've said, can this woman be able to carry a baby, deliver safely, and also go through that motherhood journey of breastfeeding?
Yes. So the first thing to mention is that the procedures that we do for breast reconstructions preserve both nipple sensation and breastfeeding functions. That is very important because in other settings, there's that limitation that the procedures are done can eventually affect breastfeeding. But ours at AJ Plastics usually preserve both nipple sensation and breastfeeding functions. That's one. Two, they can be able to carry a child to delivery because most of plastic surgical procedures usually just involve the area beneath the skin. So they don't really interfere with major organs. So we've had ladies who have gone on to have breast reconstructions who come in after delivery and they're breastfeeding their baby as well. We have ladies who come in post-liposuctions and they can carry up to the pregnancies that they desire.
All right. Yes. All right. Yes. Thomas Amuti, asante sana.
Thank you so much.
Let me just say this is the first time I'm meeting a young surgeon. Some of the surgeons I've met, are people who've gone ahead of us in terms of the age. Thank you for talking to us here on KTN News Weekend Prime tonight, just educating us on the sort of plastic surgeries that can be done, the pros and the cons. It can be, you can undo it, you're not satisfied with the entire result that you're seeing. Thank you so much for watching. A sign language interpreter is Damian Evans. To the men and the women behind the scene who've made this broadcast a success, including you, our viewer. Thank you. Enjoy the rest of your viewing. I see you tomorrow for News Desk, God willing. Good night.